We'll start with people and partners. That's where historically academic labs has been the preferred solution by many. Now with the new AI-powered capabilities we launched, customers have been extremely excited. So I'm excited as well to show you what you can easily achieve yourself. So this use case answers the question, who are the experts we should engage with and why? Let me show you how teams evaluate experts based on evidence, not just reputation, but scoring by criteria of interest. When most teams start scouting, they search for experts. Instead of browsing literature or events, keynote speakers with academic labs, it just takes a few clicks to find any expert on any topic. Let's say we search for a topic dermatitis. We find immediately 92,000 researchers on a topic. For example, if we searched for academic researchers who had a recent publication in the last year on a topic, plus a trial in the last 10 years on a topic dermatitis, in just a few clicks, we find these 140 researchers. So now the bottleneck is no longer finding these names. It's about deciding who actually matters most for your strategy. And because a top KOL doesn't exist in a vacuum, the best expert for you depends on what you need right now. Disease, biology knowledge, discovery insights, technology strength, translational depth, or trial execution, patient access, or even commercialization. Traditional scouting favors visibility. The loudest voices, keynote speakers, scientists everyone recognizes, the authors with the highest H-index, etc. The real competitive advantage sits with the people who are producing the most relevant signal right now in publications, trials, grants, patents, and translational work. And sometimes those aren't the obvious names. For example, if I click on a researcher here who is associated with the hospital and with the universities and as well with Leo Pharma, we have immediately a tailored summary on a topic dermatitis. So we see the main focus of this researcher with recent signals, what this researcher has been focusing on. I want to see if Jacob is a perfect fit for our KOL needs. Once you define what ideal fit means for you, for example, biology expertise on the disease, drug discovery focus, experience with translational work, strong reputation, industry collaboration, or other criteria, and why we need a KOL. You can save it, you can make it a default analysis, and search for a topic dermatitis within this researcher's research. I hit evaluate, and now the assessment is excellent. There's an instant assessment on our criteria with a score out of 10, always justified and referenced, for example, a publication of 2025 on that topic. So we got an instant assessment to see how well this researcher fits our criteria plus other criteria. This is not for one KOL. The real value is in analyzing many KOLs to see which one fits best and why. All that takes is a few clicks. So if I go back to the search, we have 140. I go for the AI and evaluate not all 5,000 researchers, but up to 50 with a report. So I select all 50 KOL fits. I still have this criteria available here because I saved it in my previous step. I want to analyze the 30 most recent publications on atopic dermatitis of each researcher, the 30 most recent trials, and the 30 most recent patents and grants. For each researcher, we look at the recent volume of work on the disease. Then, I can define what I want. The goal of this report is to identify the best fit KOLs with scoring on different criteria and an in-depth assessment of the best fit candidates. I hit evaluate, and now all these KOLs will be analyzed. Then, I click on View Report. I get my summary, an introduction on the topic, scoring for different criteria, and a comparative table. This allows me to identify for each KOL, for the different criteria of interest, how well this person scores with a total score, a KOL fit assessment, and a brief justification with links. We also get an Excel file with a full detailed description. We see some additional legends, so you know what you're looking at. We see different tiers, strategic innovation leaders, high value, experienced experts with rationale and example profiles, and more niche KOLs. Depending on your needs, you can identify which ones make the most sense. Here, we have some extra information for top KOLs from Tier 1. We also identify specific trends, patterns, and clusters across those. For example, niche KOLs in pediatrics microbiome, some opportunities suggesting challenges in engaging with them, and finally some recommendations that we asked for. All of this takes just a few clicks to get this kind of analysis and wait a few minutes to have the report ready. If you want to go deeper into the evaluation of a single KOL, you get the export file with the top 50 researchers here. For each researcher, we have an assessment. We see overall fit, excellent, and then the different criteria with a score and justification, like a recent multicenter, phase 3, etc. With such an assessment, you can easily identify which ones are the best fit. You can also filter for those rated excellent, getting 34 of the 50, and then deep dive on the ones that make the most sense. Now it's in this Excel file. This will be built into our platform in the coming months so that you can, in one environment, do all these analyses and always export to Excel. What does this mean for you? This turns scouting from collecting names into making decisions. Instead of manually reviewing 5, 10, 20 KOLs and missing 50, 80, 100, you can now evaluate 50, 100, 200, even up to 2,000 experts on any topic to know exactly which ones you'd like to engage first. You go from debating lists to aligning around evidence, which removes politics and accelerates decisions. You don't replace judgment, you focus it where it matters most. The real ROI isn't a list of experts, it's the clarity on who you should call tomorrow and why. Try the platform yourself right now by going to our website.